So for the next placental issue, which is kind of like a tumor growth, but not really, I don't really know. Let's just go inside, It's the Placental Mesenchymal Dysplasia. So for me, once you hear dysplasia, the word dys, it's like you scatter something. So the ways the cells are supposed to be actually growing, there's like a scattering in their arrangements. Do you understand? That's what a dysplasia is. Right. So you can see how it looks like on ultrasound, also on a histology slide. So placental mesenchymal dysplasia is a benign placental condition. It's characterized by enlarged placenta, and this placenta is having so many cysts, right? A lot of cystic lesions, right? So this resembles a molar pregnancy on ultrasound. Despite its dramatic appearance, it is not trophoblastic disease and does not involve abnormal proliferation of trophoblasts. So this one is kind of like different. So what are the features? What could I actually use to differentiate this from other possible complications that could come up? So from this image, you could see a lot of cysts. All right, cysts are all those round openings and all. So cystic is grape-like vesicles on the placenta, thickened placenta with abnormal vascular structures, no trophoblastic hyperplasia. So you can now separate this from trophoblastic disease. It's often associated with female fetus, mostly affects what? Female babies. All right. So clinical presentation. Most of the times it is asymptomatic, so no issues. Is when you are doing some 1 or 2 tests that you now pointed out, Elevated maternal serum alpha-fetoproteins, okay? Fetal growth restrictions, preterm delivery, okay? Vaginal bleeding, then fetal demise. The baby could actually die off, right? Associated conditions, that's if you see it, by itself is not really the main disease. Do you understand? If you see it, you need to suspect some other disease. Like what? Beckwith-Wiedemann Syndrome. Fetal anomalies like liver cyst, vascular malformations. Alright? It could be mosaicism. Right? It could be mosaicism. Alright? So diagnosis is ultrasound, Doppler, MRI, amniocentesis. Alright? Basically, I'm just trying to do all those images to look inside. So management and prognosis, close monitoring. You want to track the fetal ultrasound, fetal growth using ultrasound, right? Delivery planning, right? So you have to actually be prepared for all those emergencies that might come up in delivery, all right? Normal fetal development, okay? Sometimes the baby dies off. So that's it for mesenchymal dysplasia.